Imagine waking up every day, being the reason a child with cancer has hope. Being a pediatric oncology nurse isn't just a job, it's a calling. But what steps does it take to become one, and what challenges lie ahead? Post-pandemic, there has been a decline in nurses, especially in a critical care setting like pediatric oncology. Hi, I'm Abigail Ceja, a first-generation pre-nursing student who also dreams of becoming a pediatric oncology nurse. I'm also very well informed in this potential healthcare profession, and I hope to inform anybody who wants to pursue this career in nursing. Becoming a pediatric oncology nurse requires a clear progression through educational requirements, passing the National Council Licensure Examination for Registered Nurses, also known as the NCLEX RN exam, and gaining hands-on experience and specialized certification. These preparations will ensure individuals provide expert medical care and emotional support to children battling cancer. In this speech, we'll explore the dedicated path to becoming a pediatric oncology nurse, which requires a unique blend of medical expertise, emotional resilience, and compassion. I'll walk you through 1. The educational requirements, 2. The importance of passing the NCLEX RN exam, and 3. The critical experience and specialized certifications needed to specialize in pediatric oncology. I aim to ensure that student nurses are fully informed about what it takes to care for a children battling cancer. First, I will discuss the educational requirements to becoming a nurse, or in this case, a pediatric oncology nurse. Pediatric oncology nurses must meet specific educational requirements to provide specialized care for children battling cancer. They must also ensure that they possess the foundational nursing skills and advanced knowledge in pediatric oncology. In Nevada, one typically needs to complete 2 years worth of prerequisites, another 2 years of nursing school, and the classes specific to the program. According to Feeney from the Nursing Journal, many higher-level pediatric oncology jobs require or prefer to hire Bachelor's of Science in Nursing graduates. Receiving your Bachelor's of Science in Nursing instead of receiving your Associates of Science in Nursing will guarantee more positional opportunities. Many of these programs also offer 2 types, part-time and full-time. This allows students to take classes at their own pace and ensure that they can handle the intense workload. Nursing lectures, simulation labs, and clinicals ensure that nursing students gain a well-rounded education by incorporating academic knowledge and hands-on experience into clinical settings. These experiences help students develop critical thinking, clinical skills, and the ability to provide safe and effective patient care in a diverse healthcare environment. Next, I will talk about passing the National Council Licensure Examination for Registered Nurses, also known as the NCLEX RN exam. In addition to completing the necessary educational requirements, aspiring nurses must pass the NCLEX RN exam to obtain and practice within the field. Feeney from the Nursing Journal affirms that to be able to work legally as a registered nurse, one must pass this multiple choice exam. However, failing to pass this exam will prevent you from practicing, and you will have to take it after 45 days of taking your first attempt. This exam uses computer adaptive technology, and it runs from 85 to 150 questions. However, nobody really knows how to pass it. It's more so the test is gaining your knowledge through the way that you answer each clinical question. As you answer questions correctly, the more challenging the questions get. As you answer incorrectly, the more easier they get. To put it into simple words, it grades you from a baseline. This baseline basically determines whether you pass or not. As you progress through questions, you will continue going up if answered correctly. If not, you will continue going below that line. If you stay below that line, that means that you fail. However, if you keep going past and past, it ensures you that you did in fact pass the NCLEX-RN exam. While passing the NCLEX-RN exam is crucial to becoming a licensed nurse, it is especially important to gain experience within the pediatric oncology field. Feeney clarifies you can choose from various settings and specializations, such as just pediatric oncology, surgical oncology, or blood and bone marrow transplants. However, children are medically treated differently compared to an adult cancer patient. The medical specialty is far more complex than that of an adult cancer patient. And one of the most significant factors is the way that these certain invasive cancers are medically treated. According to the National Cancer Institute, the types of treatment a child with cancer receives will solely be determined based on what type of cancer it is and how advanced it is. Treatments that could possibly be given to a child with cancer may include surgery, immunotherapy, radiational therapy, stem cell transplant, chemotherapy, and etc. Now let's talk about a specific certification that a nurse needs to work in pediatric oncology. In an interview with my boyfriend's mother, Angela Brennan, BSN RN, she explains the importance of not only gaining experience in pediatric oncology, but how one must obtain a specific certification. In quote, when working in a hematology and oncology unit, one must be APON certified, Brennan says. The Association of Pediatric Hematology and Oncology, also known as APON, is an organization that provides lessons and programs for nurses to be able to be certified in various oncology treatments, such as chemotherapy. The Pediatric Chemotherapy Provider Program, also known as PCPP, is a 2-day course for nurses new to administering chemotherapy to children and adolescents. Through this 2-day course, nurses will learn how to hang and safely administer chemotherapy effectively towards their patients. You must attend their meetings, which are within 4 to 6 hours, and once you've completed the specific acknowledgement and exam, you will be APON certified. Once a nurse completes this course, they must renew their certification every 2 years to make sure that their APON certification is as current as possible. It's extremely beneficial to renew your certifications every 2 years so that your certification and your education always stays up to date. And this will be extra helpful when patients are planning to potentially sue you for certain acts that are out of your control. In short, becoming APON certified will allow you to learn how to hang chemo and effectively administer it to your patient in a way that it's extremely safe for you and your patient, especially when dealing with lots of chemicals. Now, as you can see, these 4 steps are extremely crucial if you want to become a pediatric oncology nurse. Becoming a pediatric oncology nurse requires a clear progression through educational requirements, passing the National Council Licensure Examination for Registered Nurses, also known as the NCLEX-RN exam, gaining hands-on experience, and specialized certifications. These preparations will ensure individuals can provide expert medical care and emotional support to children battling cancer. In my speech, I walk through the important steps to becoming a pediatric oncology nurse, breaking them down clearly and simply. I began discussing the educational requirements, focusing on how obtaining a nursing degree is the first key step to this career. Then I explained the role of the NCLEX-RN exam and why passing is crucial to becoming a registered nurse. Finally, I covered the experience and certifications needed to specialize in pediatric oncology, knowing how medical skills and emotional strength are a key role in this career. Overall, I aim to give an easy-to-understand explanation of the journey to becoming a pediatric oncology nurse. The future is where pediatric oncology isn't so foreign as a specialty. and that anyone who wants to pursue healthcare will want to become this kind of nurse.